I may have to make some adjustments in my home instead of just keeping things just the way they are. You might be able to identify and prevent some problems down the line. And some of that is maybe decluttering, getting rid of some things that just, maybe they've been sitting there for 20 years in that room, but you don't use them. Is it a potential problem that you could, trip and fall over something like that? And as you age, you have to look at that and go, this rug or this, piece of furniture here is great, but it really doesn't serve me anymore. And now it's a hazard to me. And recognizing that, and maybe just involving your family members as well too, to try and say, hey, I need to, start preparing. Maybe I need to make some changes around the house. Maybe I need to put some rails up in the shower now, to hold on to and balance myself, or things to hold on to that would give me a chance to not fall down and not have these accidents. So not waiting for the accidents to happen first.
On any given day, we'll go on multiple falls for elderly or retired patients in our community. A lot of times we see slip hazards, things like that. People in their shower, people getting out of their shower, they don't have rugs or non-slip surfaces, no slip there. See a lot of people fall due to clutter in their homes, just boxes and clothes. Sometimes people just have a lack of equipment like walkers or canes that they're not using that they should be using to help get them around their home. We'll see lack of rails and things like that. So those are really common reasons people fall. We'll see patients sometimes multiple times over the course of a month or things like that, and it might be new for them and it's new for us to see them. So we have those conversations with them initially about trying to be diligent about using their walkers and their canes and be up to date on their medications, visiting with their physician regularly, trying to clear hazards. When we start to see a patient a number of times and it's a reoccurring process, that's when we get our prevention involved, and we have a referral process for them. And that's when a prevention department can come in and they can assess their home and try to help them build rails and ramps and things like that, or help them assess what their risk is with walkways being cleared, and giving them resources to be in contact with for further help. People have pendant buttons, things like that as well, that they can contact, and if they do fall, they have a resource, so they're not waiting for someone to come check on them. They have a resource that's on their person that they can press and get a hold of 911 so we can respond quickly.
There are so many different reasons why people are falling. Certainly one of those areas happens to do with balance, flexibility, and strength. During our visits in which we provide education to those who have fallen, one of the points that I try to push forward is the use it or lose it, the keep moving. So often we forget how important it is to maintain muscle strength, particularly in our core, in our legs. Our balance is certainly changing as we get older, and there are really great programs within most communities in which you can take advantage of in order to really maintain a healthy lifestyle and keeping your balance.
It's important that people realize that what may be visible to them may not be visible to us. So for instance, just because you have an address marker on your road sign on your driveway and you think that it's marked, well, maybe you have it marked facing from one direction, from a direction at the road from that side, but maybe the fire apparatus and the ambulance are coming from the other direction. We wouldn't see that. Also the access to it. So is there stairways, is there driveway problems that are going to create problems for us to try and get people and equipment to you as well too?
Really common thing that we see a lot is you get these elderly patients, and a lot of times they're juggling multiple meds, and they've got a system they've been following, but they might not be visiting their doctors regularly and getting those up to date. They might be starting to have issues with just tracking what medications they have or haven't taken, and especially like blood pressure medications, things like that. People take too many, they might get dizzy, their blood pressure drops, and you'll see falls result from that. So that's a really common thing that we do go on, and it's just really important to get in and speak with your physician and have regular follow-ups and appointments and have a solid system for tracking what medications you're taking and how many of them you need to be taking on a daily basis.
The value in staying active, being mobile, is really one of the most important things one can do to help keep themselves in a lifestyle where they're active, they can stay at home independently, and they can be healthy.